Here in studio with Dr. David Klein of the Stages of Life. And doctor, we want to talk in general terms today about diabetes. But you know, if I've learned one thing from you in the 5 years we've been doing recordings and radio shows together.
It's been that long?
There's been there's been so many people that feel like diabetes, sugar. You know, the A1C, you know, the old sugar count every single day, wake up, prick the finger, all that. Do they ever think of the insulin count?
No, they don't. And the real problem is insulin is not all about blood sugar. Insulin is not all about the A1C. Insulin isn't all about anything. Diabetes, is not a singular disease. Now, there aren't two diabetes type 1 and diabetes type 2. Oversimplification really intended for grade schoolers. Yeah, diabetes type 1 is juvenile onset. It's usually following a viral illness of the pancreas. Pancreas gets burned out. You don't have any insulin at all, and you develop diabetes. Horrible problem. It's controllable, but most of the diabetes in this country is adult onset. Now, that doesn't mean that it's one disease. It doesn't mean it's one problem. It doesn't mean that it has one cause. And therein lies the problem. Okay, well, my blood sugar is 130, and that's just a little bit over what it should be. Really? Okay, what's your insulin level doing? And that'll tell you how bad the problem is. Because it takes about 20 years, somewhere between 10 and 20, for somebody to go from pre-diabetes to diabetes. And they're going to go, well, gee, what's the difference? And the answer is very, very simple but surprising. There is no difference. It's the same disease. Pre-diabetes is nothing more than the same type 2 diabetes that you see out there, except that it's earlier in the course of the illness. Now, what am I talking about? Okay, and it works something like this. You measure blood sugar. And a normal, healthy blood sugar is between 75 and 85, not 110 to 130. Not, gee, if it's over 100, it's abnormal. No, between 75 and 85. Why is this? And why is this different from what you've heard? And it's because for every milligram percent over 85, your life expectancy diminishes. Ooh. So the disease process starts far earlier and far younger than we might have previously suspected. Now, how do you know that you've got an issue? Well, it's not just the blood sugar. Why? Because I told you so. No, it works like this. Insulin levels start to creep upward, maintaining the same blood sugar. What does this mean? It means that the disease is something called insulin resistance syndrome. Insulin levels go up long before the blood sugars do, long before the A1Cs do, and oddly enough, just about the time you're starting to gain weight is when you start seeing issues with this pre-diabetes, this insulin resistance, sometimes also known as metabolic syndrome X. Interesting business. Your weight starts to go up long before you really measure the problem. Now, when do you start to address this? When you recognize what the possibilities are. Because chances are your doctor is not going to diagnose this well. They're a routine A1C. Well, your A1C, glycosylated hemoglobin A1C, is an end product. Okay, it's glycosylated hemoglobin. It's what happens if your blood sugar is too high. The sugar sticks to things, the endothelium of your blood vessels, but also to the red cells. So if a certain percentage of it is over and above what it should be, they'll say you have diabetes. Well, the fact of the matter is that by the time you see an elevated A1C, you're already seeing end organ damage. You're already seeing measurable problems in your eyes, kidneys, heart, and elsewhere. So the trick is not to wait until the A1C gets wonky. Check your insulin level. It's a $15 test, for God's sake. Okay, it's cheap, it's easy, and what you do is you look at the ratio of glucose to insulin. And when you start looking in that way, if you start looking at the ratio, you're going to start picking things up while there's still time to save your butt. Okay, this is not that difficult. So the weight gain typically starts 10 years before the diabetes gets diagnosed. That's 10 years worth of lost opportunities. Now, what do you do? Okay, we can look at it and divide this into little pieces if you choose, but it's really one approach, and that's to fix the issue that's causing the cells to become insulin resistant. And it's not a medicine necessarily, it's not a lifestyle choice necessarily, but it's a combination of things. It almost always starts as a vanadium and chromium deficiency. And you're going to go, what the heck is he talking about? That sounds like the shiny parts on cars. And in fact, it's the same mineral. Vanadium and chromium, these are two different minerals, are necessary for the insulin receptor to work. Now, not all vanadium is the same, not all chromium is the same. It has to do with something called transition metal chemistry. I'm not going to bore you with the details, but it has to be in the right shape. It has to be in the right valence. It has to have the right d orbital configuration, or the mineral doesn't work the way you want it to. Very simple, very straightforward, but very, very meaningful. So vanadium and chromium deficiencies cause diabetes. Wouldn't you know it? Well, where do we get them from? You're not going to get them from the big box stores. You're not going to get them from eating Girl Scout cookies. It's supposed to be in our groundwater. Groundwater feeds the crops. Groundwater feeds the cattle. You're supposed to get it from the crops, your water, and or the cattle. But if it's not in our water supply, then you're going to become vanadium and chromium deficient. And that's what seems to be happening here in Florida and across much of our country. The groundwater is deficient in these minerals. Why? It could have something to do with the processing. It could have something to do with, there are very few places in the country that the water goes through mountain or real rocks. Like around here, it goes through limestone. Mm-hmm. This is not mineral-laden water. So we end up seeing a large number of folks with diabetes. It happens with some nauseating regularity. What else can cause insulin resistance? And this is a little bit less predictable. Vitamin D deficiency. Wouldn't you know it? Vitamin D deficiency can cause diabetes. You betcha. Okay? Poor sleep can cause diabetes. Very predictably, it does seem to work. Why? It's a little unclear, but it may have a little something to do with your immune system not working properly, your digestive tract not working properly, and then the weight gain that you see from that. The medications that we use to treat diabetes are also very, very important. So if you've got elevations in insulin to maintain, to keep a blood sugar normal, and high levels of insulin make you fat. Now, why does this happen? When insulin goes up, blood sugar is supposed to drop, but it also chases fat into your cells. Insulin has more than one effect. It chases not just sugar, but triglycerides into the fat cell. So the higher your insulin, the greater the likelihood you're going to gain weight and not be able to get it off. So in order for you to lose that weight that everybody's trying to lose by taking a singular pill and paying a singular fee and losing 40 pounds in 40 days or whatever nonsense you're being peddled, the whole idea here is to lower your insulin level and you will lower your weight. Vanadium and chromium are a good place to start. My favorite medication for this is metformin. Why do I like metformin? Because it predictably lowers insulin. It predictably lowers triglycerides and cholesterol. It also predictably lowers weight, and it's wickedly expensive. In fact, so much so they give it away for free at Publix. So the long and short of it is, for almost nothing, you can start bringing down your insulin, but in order for this to occur, you need to know what the blood insulin level is doing. Now, why do you care about A1C? I technically don't. I don't really give a darn what the number is. I'm more interested in insulin to glucose ratios. But the A1C has another function. You almost never hear about it, mainly because I haven't lectured about it so much yet. But A1C is a measure of how well you're doing in terms of anti-aging. Because if you're seeing glycosylation of the hemoglobin, you're also seeing it in other tissues like the eyes, kidneys, and skin. And if you want to age prematurely, get your blood sugar up. If you want to age prematurely, get that A1C up, because not only is it glycosylating the hemoglobin, but it's also glycosylating your skin. Now, what does this mean? It means you're going to look old. What does this mean? It means you're going to start feeling old. What does it mean? It means the arthritis is going to start getting worse because the inflammation that goes along with the elevations in insulin. So almost every inflammatory disease that you have or could possibly get is going to be made worse by this insulin resistance syndrome, which you would not know as something other than pre-diabetes. If it's pre-diabetes, it must not be a problem yet. It's like preschool. Okay, well, it doesn't really count. No, it actually counts more. It counts a hell of a lot more. Why? Because if you can catch yourself early in the course of an illness, you have a much greater chance of making a meaningful change and improving your life, your longevity, and preventing nasty things from happening like cancer.
All right, and what you want to do is learn more about the doctor, more about stages of life by visiting suffernomore.com, suffernomore.com, all one word. And once you've checked in there, you get yourself looked over, you become familiar with the nutraceutical store. And once you're familiar with that and you get yourself on a regimen of the right nutraceuticals, well, by golly, they can have them shipped to you each and every month in the new stagesoflifevitamins.com program. Check it out, and here's more contact information.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.